In this comprehensive deep dive, you'll gain expert-level knowledge about bipolar disorder, with detailed information covering every aspect from progression patterns through cutting-edge treatment options. If you've watched our Breakthrough Bipolar Disorder Guide, you're ready for this complete resource covering progression, risk factors, diagnosis, medication options, holistic approaches, self-help strategies, and practical support systems. This evidence-based guide synthesizes the latest medical research with practical guidance for lasting wellness, giving you the complete toolkit for understanding and effectively managing bipolar disorder in 2025 and beyond. Progression and health. Impact without intervention. Bipolar disorder typically follows a progressive pattern that can significantly impact overall health and quality of life across multiple domains. Initially, symptoms may present as mild mood swings or unusual energy levels, but they often expand to affect relationships, work performance, and physical health over months to years. The condition can evolve from isolated mood episodes to complex cycling patterns that influence sleep, concentration, decision-making, and social functioning. The psychological health impact extends beyond primary symptoms, as bipolar disorder episode frequency can affect cognitive function, stress response, and overall brain health. This cyclical activation can contribute to relationship strain, job instability, and secondary mental health complications including anxiety and substance use disorders. Bipolar disorder increases risk for cardiovascular disease, diabetes, and obesity, as well as treatment-related side effects, making early intervention crucial for preventing these additional health challenges. However, understanding progression also reveals hope for intervention at any stage. Even long-standing bipolar disorder responds well to treatment, and the brain's neuroplasticity healing mechanisms allow for significant improvement regardless of episode duration. Modern treatments can interrupt cycling patterns and often restore stable mood regulation, returning normal functioning and well-being within 3 to 6 months of beginning appropriate care. Recent longitudinal studies show 80% improvement statistics when comprehensive treatment approaches are implemented consistently with proper medication adherence. Underlying causes and risk factors. Bipolar disorder results from a complex interplay of genetic, neurobiological, environmental, and psychological factors, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history or specific gene variants like AKAP11 increasing risk, but having risk factors does not guarantee developing the condition. Biological mechanisms. Differences, particularly involving serotonin, dopamine, and norepinephrine neurotransmitter systems, contribute to increased bipolar disorder sensitivity. Environmental factors include chronic stress, trauma, major life changes, and substance use, such as stimulants or alcohol that can trigger initial episodes. People who have experienced childhood trauma show increased likelihood of developing bipolar disorder. However, many people with these risk factors never develop the condition, while others with fewer risk factors do, emphasizing the individual nature of bipolar disorder. Additional factor categories encompass hormonal influences, including thyroid dysfunction, seasonal changes, and reproductive life events. Physical health conditions, such as brain injuries and autoimmune disorders, can trigger or worsen bipolar disorder symptoms. Sleep disruption, irregular schedules, and high-stress careers also influence development and progression patterns. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that bipolar disorder is a legitimate medical condition requiring professional treatment rather than personal character weakness or life choices. Comprehensive diagnosis and assessment. Professional diagnosis involves a thorough evaluation considering symptoms, medical history, and functional impairment across life domains. Specialized healthcare providers, including psychiatrists and psychologists, use standardized diagnostic criteria and validated assessment tools to ensure accurate identification and rule out other conditions with similar presentations. The diagnostic process typically includes detailed psychiatric interviews about episode patterns, duration, severity, and impact on work, relationships, and daily functioning. Physical examinations and comprehensive laboratory tests help rule out medical conditions that can mimic bipolar disorder symptoms, such as thyroid disorders, neurological conditions, and substance-induced mood changes. Many people feel relief during the diagnostic process because it validates their experiences and provides a clear path forward for treatment. Healthcare providers emphasize the collaborative nature of diagnosis, encouraging patients to openly discuss all symptoms without fear of judgment or stigma. The diagnostic process also identifies co-occurring conditions like anxiety disorders, attention deficit disorder, and substance use disorders, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of bipolar disorder presentations and focus on comprehensive assessment rather than symptom severity alone. This thorough approach ensures treatment addresses all aspects of the condition and maximizes likelihood of successful recovery. Strategic doctor questions for optimal treatment. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected timelines for improvement, and specific criteria for measuring progress. Treatment options inquiry. What treatment approaches do you recommend for my specific type of bipolar disorder? And what are the advantages and challenges of each option? Are there newer treatments or clinical trials that might be appropriate for my situation and symptom pattern? Timeline and progress. Questions. What should I expect in terms of mood stabilization timeline? And how will we measure progress throughout treatment? What would indicate that we need to adjust or change the treatment approach for better outcomes? Side effects and management. What are the potential side effects of recommended treatments, and what strategies exist for managing them effectively? What should I do if I experience concerning side effects, or if the initial treatment doesn't provide sufficient mood stability? Lifestyle integration. What lifestyle modifications can enhance treatment effectiveness and improve my overall mental health? How can I integrate treatment recommendations into my daily routine for optimal results and maintain stability? Experience and approach. What is your experience treating my specific type of bipolar disorder, and what is your general approach to treatment planning? How do you stay current with the latest treatment advances and research developments? Support and emergency planning. What warning signs would require immediate medical attention during treatment? How can I access care between appointments if needed? Would involving family members or support persons in treatment be beneficial for my recovery? Advanced medications and treatment effects. Modern bipolar disorder medications offer effective mood stabilization with significantly improved safety profiles compared to earlier treatments. First-line medications such as lithium, lamotrigine, and quetiapine remain primary treatments, typically requiring 4 to 8 weeks for full effectiveness while producing fewer side effects than older medications. These medications work by stabilizing neurotransmitter function, regulating brain activity, or targeting specific receptors to maintain mood balance, with 70 to 85% success rates for episode prevention. Newer medication classes, including long-acting injectable antipsychotics, show promise for enhanced outcomes, including improved medication adherence and better quality of life compared to traditional options. Next-generation treatments induce faster mood stabilization and are more precisely targeted, avoiding the widespread effects that previously deterred many patients from medical treatment. Additional medications may be prescribed for breakthrough symptoms while longer-term treatments take effect, though these require careful monitoring to prevent drug interactions. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different options to find optimal results. Most people experience substantial improvement within 6 to 12 weeks of starting appropriate medication. Side effects, when they occur, are typically mild to moderate and manageable, including weight changes, sedation, and tremor that often resolve as treatment continues. Emerging treatments in 2025 include CAMKK2 pathway modulators and AMPK activators that offer targeted approaches for people who haven't achieved optimal results with traditional medications. These advanced options provide hope for complete mood stabilization and improved cognitive functioning. Holistic and complementary approaches. Integrative treatment approaches combining conventional medicine with evidence-based complementary therapies show enhanced effectiveness for bipolar disorder recovery. Recent studies demonstrate that psychotherapy, exercise, and sleep regulation can improve treatment outcomes by 30 to 50% through mood stabilization and stress reduction mechanisms. Regular physical activity such as aerobic exercise, yoga, and strength training produce powerful therapeutic effects by regulating neurotransmitters, improving sleep quality, and enhancing overall mood stability. Mind-body approaches including cognitive behavioral therapy, dialectical behavior therapy, and mindfulness meditation provide practical tools for managing mood episodes while building long-term emotional regulation skills. Complementary therapy examples show significant benefits for some people, particularly when combined with conventional treatments. Sleep hygiene, circadian rhythm regulation, and stress management techniques support overall brain function and may enhance treatment effectiveness through neuroplasticity mechanisms. Community and support approaches have proven incredibly effective in providing peer understanding, practical assistance, and hope that people often need for sustained recovery. These approaches recognize that healing encompasses the whole person, not just symptom management. The combination of traditional and complementary treatments often produces better outcomes than either approach alone, offering multiple pathways to recovery and long-term wellness. Integration strategies help people customize their treatment approach based on individual preferences and response patterns. Over-the-counter support options. Several over-the-counter supplements and products can provide supportive benefits for bipolar disorder management when used alongside professional treatment. Omega-3 fatty acids, vitamin D, and B-complex vitamins help brain function and mood regulation, particularly beneficial for people experiencing treatment-related fatigue and cognitive issues. Additional supplements including magnesium, N-acetylcysteine, and inositol support neurotransmitter balance and may reduce inflammation associated with mood disorders. Research suggests these compounds play supportive roles in brain health, supporting the use of targeted nutritional interventions. Specific products, including light therapy devices and sleep tracking technology, show promise for managing circadian rhythm disruptions and seasonal mood changes through biological clock regulation mechanisms. Additional OTC options have mood support effects for some people, though these should be discussed with healthcare providers to avoid interactions with prescription medications. Environmental products can provide immediate comfort during mood episodes, including white noise machines, weighted blankets, and aromatherapy diffusers. These supportive measures work best as part of comprehensive treatment plans rather than standalone solutions, complementing rather than replacing professional mental health care. Empowering self-help strategies. Comprehensive self-help strategies provide immediate tools for managing bipolar disorder while building long-term resilience and recovery skills. Mood tracking techniques quickly identify patterns and triggers and can be used anywhere episodes begin, providing powerful tools for early intervention. Additional techniques help identify and address warning signs that often precede mood episodes. Cognitive and behavioral techniques include thought-challenging, behavioral activation, and interpersonal effectiveness skills that bring empowerment through symptom management mechanisms. Creating structured daily routines provides stability and predictability that reduces episode triggers while supporting overall mood and energy stability. Regular sleep schedules, meal timing, and social connections support overall circadian rhythm regulation and create natural mood protective effects. Gradual stress management activities help overcome lifestyle patterns that can maintain mood instability. Keeping detailed mood journals helps identify triggers and successful coping strategies, building self-awareness and treatment empowerment. Building strong social connections and maintaining meaningful activities prevent isolation and provide natural emotional support benefits. These strategies complement professional treatment and provide sustainable tools for long-term bipolar disorder management and continued personal growth. Supporting loved ones. Effectively, supporting someone with bipolar disorder requires understanding, patience, and knowledge about effective approaches that truly help, rather than inadvertently causing additional stress. Listen without judgment and avoid minimizing responses such as suggesting they just think positively or comparing their situation to others, as this invalidates their experience and can increase emotional burden. Instead, acknowledge their feelings and ask how you can best provide support during difficult episodes. Learn about their specific triggers and early warning signs, and respect their need for treatment adherence while encouraging healthy lifestyle choices rather than pushing for unrealistic expectations. Offer practical support like helping with medication reminders, attending appointments, and maintaining routine household tasks during episodes including grocery shopping and childcare assistance. Encourage professional treatment while avoiding becoming their primary therapist or trying to manage their medication decisions. Maintain your own well-being and set healthy boundaries to prevent caregiver burnout, such as emotional exhaustion and resentment. Support groups for family members and friends of people with bipolar disorder provide valuable resources and connection with others in similar situations. Celebrate stability periods and progress, understanding that recovery often involves ongoing management with occasional challenges. Specific encouragement strategies, including recognizing their strength and offering consistent support, help maintain hope throughout the treatment journey. Comprehensive prevention strategies. Building resilience and implementing prevention strategies can significantly reduce bipolar disorder episode frequency and prevent recurrence in people with previous episodes. Regular preventive practices, including medication adherence, sleep hygiene, and stress management, create a foundation for mood stability while protecting against episode triggers. Developing healthy lifestyle habits early helps people maintain optimal brain function without developing episode-promoting conditions. Maintaining protective factors including regular exercise, social support, and meaningful activities provides natural buffers against environmental and psychological risk factors that can trigger bipolar disorder episodes. Learning to identify and address early warning signs before they become full episodes prevents the development of episode-maintaining cycles. Regular mental health monitoring practices and maintaining treatment relationships help prevent symptom accumulation over time through proactive care management. Early intervention during high-risk life stages when episodes often begin can prevent progression to more severe mood cycling. Education about bipolar disorder helps people recognize early warning signs and seek help promptly when changes occur. Building emotional regulation skills enhances protective knowledge and reduces specific environmental and lifestyle triggers that contribute to bipolar disorder episodes. These prevention strategies benefit everyone regardless of bipolar disorder family history by promoting overall mental wellness and emotional resilience. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,